So you can go ahead.
All right. Um, Call to order. Yeah, I know Casey's out. Do we have quorum? I'm
We
counting.
do now.
We
Yeah.
do.
Mhm.
Perfect. Then can I hit someone we're gonna approve minutes for December. Do I have somebody who wants to start approval?
I'll make a motion to approve the minutes for December.
Second.
Second.
Oh, yeah.
Perfect. December meeting minutes are approved.
Thank you.
So,
Malika, I think you have to
You
actually
have to
take
ask for
the
a vote.
oh,
Those in favor.
there's
Yeah.
all in favor.
aye.
I
Aye.
Lovely,
Anybody
lovely.
dissenting? Okay.
Okay. Well, what happened?
So motion carries and we have
Just
that approval of the minutes.
perfect. Yeah. Do we want to go around and do some introductions?
Yeah, I was thinking today the introductions would just be your name and just like a one word to express how you're feeling in this moment. So we have a lot to get to. And you can say whether you're a member or a visitor.
My name is Malik Alexander, he, him pronouns. I am a member of the board. Um, and in my day job, I oversee services in East Multnomah County supporting houseless youth.
One
Who was,
word.
oh, frazzled. It's Monday. I'm frazzled. Um, I
okay.
can call on Jesse.
Thank you. My name is Jesse Powell, Commissioner. He, him pronouns, and one word is inspired. Any takers, or I can pick
Pick.
Alicia.
I knew you were going to call me Alicia Richard, member, and I'm feeling anxious today. That's the word I have. I got anxiety. There we go. But I'm always grateful, so I always try to keep that in there. Pamela.
Yeah, Pamela Heisler, Commissioner. One word. Honestly, when you said anxiety, I was like, oh yeah, that's what's going on in my belly. So I think I travel tomorrow for work, and I know, airlines have had issues. There's a huge winter storm hitting the center of the country that I'm gonna have to pass through. The world seems to be on fire. So yeah, anxiety, fortunately. And I'll pick Mary. Good to see you. It's been so long.
Good to see you too. I'm Mary Keelan. I use she, her pronouns. I'm a visitor here today, and I would say my word is a lot. Everything's feeling like a lot right now. I will pass it to Lydia.
Good morning. Sorry, my throat is going in and out, y'all. Lydia Sturba, she, they pronouns. I am on Mary's team and I am observing today. And my word is I'm a little overwhelmed. I think that's where I'm gonna sit today. And then I will pass it. I don't know who all has already gone. I'm gonna go Michelle.
All right, Lydia. Uh, my name is Michelle Pfeiffer. I'm the legislative coordinator for child welfare and for Otis. I was trying to think of my word, and I knew you were probably going to call him because I wasn't ready. I feeling a bit like heavy-hearted, I think, from everything. So yeah. And I will pass it to, did Matthew Miller, have you gone?
I have not.
All right.
Hi, my name is Matthew Miller. Hopefully joining soon. So visited today. I'm the owner of Miller's Barbecue here at the DHS office in Northeast Salem. And my word today is content. Oh, and I will pass it off to Matt's iPhone.
You're muted.
Thank you. Hi, I'm Matt Kroll. I'm law enforcement. I'm a member, and I'm going to steal the other Matt's word, content. And I'm going to pass it off to, I think the judge hasn't gone yet.
Morning. I'm Megan Jaco, and I'm a commissioner. I am feeling a little bit indignant right now. I was just watching the national news. I will pass it to Adam.
Hey, folks. Adam Rodakowski, he, him pronouns. I am just an observer here today, observing all these smart folks from child welfare and you all. And I think I'm a little crispy, I think is the word that I would use to describe how I'm feeling. I think we've got Kim hasn't gone? Or
Thanks,
Dee?
Adam. And I'll be on camera in just a second, folks. But Kim Keller, she, her pronouns. I'm the child permanency manager for child welfare, and I'm a regular visitor here. I have to say, with the blue sky and the sunshine that I am seeing out my window currently, that always makes me feel optimistic. So that's my word for right now. If it were a gray, cloudy day, it would be the opposite of that. But gotta love the sun while we have it. Ellen, I don't think you've gone.
Oh, yeah. Hi, thank you. Ellen Bell, she, her pronouns, coordinator for the commission. And I am feeling hopeful today. And I think it has to do with the sun and having a relatively restful weekend. So hopeful. And I will pass it over to Dean.
Thank you. Thank you. My voice sounded like it cracked for a moment. So I'm Dean Salazar. I'm a commissioner here on the commission. I work in Portland Children's Levy and a bunch of other stuff. And I'm feeling whelmed today. Not over, not under, just whelmed. When's the last time you heard someone use the term whelmed? So I'm claiming it. And that's everyone.
Oh, no, we have our visitor and Stacy, maybe you want to introduce yourself, even though you're going to introduce yourself a little further down the road here.
Hi, I'm Stacy Mailer, and I'm on the Family First team and working on housing barriers. So glad to be here. She, her pronouns.
Is that everybody?
Awesome.
Did we get everybody?
Believe so.
Okay.
Moving on. So I know that we have nobody has officially stepped up to take on the role of Secretary Note Taker. And so something that me and Casey and Ellen kind of talked about was an idea of potentially doing a rotation. Recognizing that like as someone who has taken notes, feels like it does you're in the mood, like, you're in the mood, you're taking notes and you're not really able to engage fully. And so thinking about a rotation of all of the commission members and wanted to check in and see for folks who are all on the commission if a rotation would be something that folks are interested in. Also wanted to bring to the group if folks have other ideas, but I think this would be the most equitable way to share the responsibility. If I could get all in favor, thumbs up or yes. Yeah, looks like try to see is everyone like in favor of it. Dean's not about it. Dean's like absolutely not.
It would be a lot easier if we would distribute a template of what we want the minutes to look like. If it's going to be all different people.
One more time, sorry, Judge.
Can we arrange to distribute to all of the commissioners a template of what we want the notes to look like?
Yeah,
so that they're somewhat the same.
Yeah, absolutely. I think that could be something very easy for me and Casey and or Ellen to come up with. That would just be like kind of like a plug and play of
Yeah.
what's being discussed during the meetings. What I can do, me and Casey can circle up, is just come up with like a general rotation for everybody. And so really, you would only really be taking notes once or twice potentially on where you're at a year. Um, unless, again, bringing it up, if anyone here wants to step up and take on the responsibility full time.
And the other thing is if we did speak about if you really do not, like for those that put their thumbs down, we want to respect that as well. And so if you are a thumbs down, we respect that. And we'll just come up with a template for everyone else who feels comfortable with that. But the other point is acknowledging Alicia, Richard, because ever since I've been here, she has always taken the notes, and she does this amazingly great job of it. And she's so responsive. And whenever I'm like, oh, we don't have the notes or the minutes, she's right on it. So I really want to give her a shout out of appreciation that Alicia's been really great to work with. I'm sure Pamela can testify to that as well, since she worked with her for the last couple of years before Casey and Malik. So thanks, Alicia.
My pleasure.
And are you taking the notes today?
I am taking the notes today. Yes. Yes, I am. Except for when we didn't really all vote, I just said that it mostly carried the motion or whatever for the notes, and that if anybody opposes that they don't have to do notes. So that's what I wrote in there. It's in there.
Does that sound good to you, Malik?
Yeah.
She called for that motion. Yeah. Okay.
Yeah, sounds good.
Okay, great.
Jesse, I see your hands up.
Yeah, I put my thumb down, but I would also like the template so I can kind of analyze it and see if I can't be comfortable with stepping up. So
sounds good.
If I can do it, you can do it, Jesse. And then, I was just about to have to run this meeting for a few minutes, and I had no idea that was part of my role. So I don't think that's ever happened though, and I've been on this for a very long time, where the secretaries had to call the meeting to order.
Well, thank you. Just the same. Yeah, Casey's joined us now. And hey, Casey, we've just gotten the minute taker discussion finished. And
perfect. And I am driving right now, Ellen, for the next couple minutes. I just left work. So if you guys want to keep rolling, I'm here.
Yeah, and thank you, Matt Miller. That's great. We really appreciate you offering. Thank you. And we look forward to hoping that you'll be joining us soon. So I wanted to introduce Stacy Mahler from the Family First team. And as most of you know, I've had the pleasure and it's been really great working with at least half of my time with the Family First team. It's been a great team to work with, and everybody has so much to contribute and teach us all. So Stacy is the teen supervisor in permanency, but I'm going to let her say a little bit more about her role. And this was one of the topics that was brought up in the last meeting, that people were wanting to talk more about housing options for youth and youth aging out of foster care, and what the commission could do to assist. And Stacy's going to come. She's here for this session, and she'll be at our next meeting in February for a follow-up if we want to put something on the agenda where you all might want to fashion something that you could support. But we'll get a little bit more information about that today and what the next steps would be for February. So then turn it over to Stacy.
Hi, everybody. So I am right now in a rotation as part of the Family First team, but I'm coming from years of being a teen unit supervisor and a teen caseworker, and did some other work before that. But teenagers are pretty close to my heart because of that. Just spent a lot of time thinking through this. So it was a natural fit when this job involved housing barriers to spend quite a bit of my time on the young adult housing. And so one of the things that I had put together, was, just an overview of young adult housing. Because one of the things that even a caseworker struggles with, especially because in most of the state, they don't specialize just in teen work. Certainly in the bigger areas, you can specialize in teen work, but in most parts of the state, they're going to, have one teenager or two teenagers and then the rest younger kids. And so, it is a challenge because you're talking about they're looking at certification. They're then looking at our treatment services team that does BRS and other placements. They're looking at youth transitions that does independent living and subsidy and Chafee. And then they're looking at the foster youth independence vouchers that really don't have one place of organization. And so that is a lot for them to kind of figure out and navigate even as caseworkers. So, so I thought it was important to kind of put all that information in one place. I am going to go ahead and try to share my screen now. And hoping everybody can see it now. Okay. So, so this I put together just as a summary for people. It's not going to have every minute detail, but it at least walks us through some of the young adult housing that we have available through child welfare. And then the goal is to kind of talk through treatment services is one area that has this. Youth transitions has a little bit of this. And then as a smaller portion, I talk about the housing vouchers. And the reason why that's kind of small is because it doesn't kind of live in one program area. It is done differently in every community, which obviously makes it that kind of challenging for people to locate it. And so that is something that, is important to me and something that we've been working on, but I'll talk through that a little bit more later. So we start through the treatment services. So they have a couple or 3 transitional living programs. And so, here are 2 of them. Here's the 3rd one, and I'm going to share this with you. You are welcome to look through it. I don't feel like it's necessary to go through every detail. But you've got these 3 programs here. And then if you move on to youth transitions, the same is true for them. They have 3 separate youth, programs that are supposed to be kind of focused on some of those independent living goals. And a young person that really is ready to start making a transition to adulthood and really doesn't want necessarily a parent. They want, a situation that they can test out some of those skills. So these programs are summarized here and what their eligibility is. But the big deal is when you look at this is like we have a whole state. Well, we have now 6 programs. And clearly we would love to have more. This doesn't feel like enough because it really doesn't cover some of those more rural parts of the state for the most part. And so, that's why, we're grateful to have some programs that can exist statewide. So subsidy housing and Chafee housing are both programs that exist statewide. They are also through youth transitions. They can be high barrier for some young people because it is requiring them to have 36 productive hours a week. It is requiring them to do a budget with either DHS and an independent living worker, or in the case of Chafee housing, it could be just an independent living worker every month. And sometimes the budget won't change. So that, they might just review it and say, this looks good. But in general, that is a lot to ask for a young person to come forward and present that. But that is the program. It can provide financial assistance. So it provides that flexibility of where they could live. In subsidy housing, they are still in care and custody. And so there's a lot of supports around them. In Chafee housing, they have left care and custody. But it does, again, give that flexibility that they could rent a room from somebody, they can rent from a relative. In Chafee housing, they can even rent from a parent, basically. That was a new thing since I did Chafee housing, but so it allows some flexibility, which is great there. Again, the downside is it is hard work to do this program. And so it's really not for everyone. And that's why kind of lastly, the biggest housing program that we have room to expand on are our FYI vouchers. And this one says FUP youth and foster youth independence. FUP aren't as available, so I'm going to focus on FYI, but the criteria are the same. So this is a housing voucher through the housing authority. The housing authority has to have a memorandum of understanding with the local child welfare so they can verify eligibility. but the biggest barrier is child welfare has to be able to offer supportive services. So supportive services, often are covered by IOP if it's a young person that is utilizing IOP. But this eligibility is actually broader. So we really want, places to be able to like lean on their local homeless youth providers and things because they can also qualify. So you can have a young person that meets the criteria for independent living, just that level of support and those supportive services, but they have to have been in care a certain amount of time. This housing voucher says you need to have been in care at some point in your life, which again is why it is so important for us to continue to look at expanding this, and something that the administration has been really clear that they want to continue. So that's promising, and so that's why I've spent a lot of time, just trying to support communities and considering adding this. So right now we have 21 public housing authorities, and we have 9 that currently have vouchers. Currently have an agreement. There's a couple that have gone on pause, but 9 that have agreements and 1 that's in process. And part of the thing that we have been working on to forward that process is we're doing a pilot that will provide some housing navigation service. So, we know that it's challenging that move in, whether you're a child or, young adult that is just coming out of childhood and then is maybe doing their first rental and could also have issues on their rental history or an arrest or different things. And then just the life experience of renting your first place. And so, so it's hard for anybody, but, obviously incredibly so, a young adult that is just doing this for the first time. And so that housing navigation to us is a big piece that we're hoping to be able to offer more. And so we're starting with 4 communities to give them this housing navigation to see if that could, 1, make the process easier for that young person, but to, make it easier for everyone around by being a bit of a facilitator and an expert in this area. So the vouchers are 3 years in length, could be extended under some conditions to 5 years. And basically, it's like any other Section 8 or housing choice voucher, meaning that the goal is that that person is paying about 1/3 of their income as rent. So if they're on Social Security and they're getting $900 a month, they would pay about $300 in their rent. If they have wages, whatever that is, they can technically have 0 income. That is hard to do, but it can happen because you can have young people that maybe have food stamps, and somebody pays their phone bill or something like that, and they could technically get by without income. Again, rare, but it's the case. And so these are them, and here just I went through some of our trainings. Again, I will be clear, it's not enough, but I also want to be clear that there's great potential in those housing vouchers. And so I feel really strongly that we should, be working on that. Here are the communities now that are doing the vouchers. And unfortunately, 2 of our bigger communities are on pause. And so Washington County, I have been asking for an update because they have been on pause for a while, but had given an indication that they hope to restart in 2026. I know it's been difficult with, us going into the budget issues that have been going on federally. And the shutdown and everything. And so I'm hopeful to get an answer soon. And then Multnomah had gone on pause. And, I have been in communication with them. It does not look like they're likely to do vouchers this year. They're really worried about their ability to do this, but we're still having conversations, and I still have hope. And so just a summary of the supportive services. So this is what I mean by these supportive services really could be provided by a lot of our agencies. So independent living programs are certainly those are things that they're already doing, but also many of our homeless youth providers are doing these kind of things. So, I think it's, us kind of stepping up and recognize, and all of us, I think, recognize we have young people in our community that need these vouchers. And so how do we figure out, the best ways to support the young people with those supportive services? I will also make it clear that what HUD says in their NOFO for, getting these vouchers is we have to offer those services. So if a young person decides 3 months in, hey, I'm in my unit, I've got plenty going on. I don't need your services. They have the right to say no. We don't take away they don't take away vouchers if somebody says no to services. We just have to offer them. So that's the big thing for me, is like, where I can get excited about. I think all of those things, that there's some wonderful programs out there, but the area for growth right now is what I see here. I will also say just really quickly, because I hopefully people might have some questions and some things for me to come back with. Another thing that I felt like it was important to work on is this. I did a training that I would like us to do in different parts of the state. This was specifically directed at, like, I did one at our Multnomah and one for our Tri-County area that talks through some of this, with the goal of having all of these people in one place. So having mentors, having ILP, having young people, having all of them in one place. And we go through the programs that I talked about before, but then we also go through like what's in the community. So that's, so I found like this kind of thing where we can engage everyone in the conversation and give them an overview. So even they know questions to ask, and then, obviously can email out the PowerPoint. I haven't yet worked out how this is going to go to every community, but I am trying to get communities to do this for themselves, because I don't want them to, spend time focusing on this and realize like, oh, Stacy's talking about all these things, but like that's not in our community yet. So that's why I would want it tailored to each community to make sure that they are kind of maybe not talking up all the Multnomah programs, but talking out what may be local to them. So that's what I am kind of, again, very excited about, and really hoping that I can continue to move forward. And I am really open for ideas and suggestions of how to do that. And just open to those dialogues. All right, so I am so not used to this. Okay, there's stop share. So yes, absolutely. I am happy to send out the slides. I have sent the presentations to Ellen already, so she can share those out, or I can reply all to this group, whatever's easiest. Oh, and I see one more question in there. There are 9 of 21 housing authorities currently participating and working on a 10th. One of the things that has been the biggest barrier is that providing those services. So I will say that despite me clarifying that HUD says offer those services, we absolutely want to do a good job about that and make sure it's people that are comfortable working with young people and have skills in that area. So some people have doubts. One, they don't have a bunch of money hanging out to figure out how to fund extra services, because with the vouchers, you can start ages 18 through 24. Well, our ILP ends at 24. So that means you've got you have young people that could start even after ILP ends. So who is funding that? So, you want these conversations to be happening in your local community. So, I would certainly hope that anyone who's interested, whether that's, DHS who's leading, or a community agency that's wanting to push, that they should be pushing, that they should be raising this conversation, be like, hey, I have heard we don't have vouchers. Can we have this conversation? Because one of the things that child welfare doesn't always know when they're in the midst of their crisis and everything that's going on for them is how many people that left 3 months ago, a year ago, 2 years ago, 4 years ago are homeless now or at risk of homelessness. That's not necessarily on their radar, because what they're doing, I think they know it in their heads that there's a much higher risk. But again, when they're in the midst of their crisis, I don't think they always know that. And so sometimes our community providers know that way more than we do. So, and it's something that is asked in HMIS. So in the homeless youth system, or in the homeless system, it should be a question that they're asking. So that they should know. I've had providers say, hey, we haven't consistently done that, but I can look at data for the next 2 months and make sure I have numbers for you, so that I could go back to child welfare and say, like, hey, I've talked to your ILP providers. I've talked to a homeless youth provider locally. This is how many I've seen in 2 months. This is why I think that you should consider this. And I'm happy to do that. Jesse.
So, have you heard of the Keeping Families Together model? You have, right?
Yeah.
And so, like, as you're talking about this, like, I'm just because I've been trying to push for how can we involve youth, right? Because I understand the FUP voucher and the way that they were created and utilized, and so as you're talking about this, I know utilization is a big piece of the FUP voucher, right? If you can utilize more of them efficiently, that's getting them hand in hand and leased up. That's a successful utilization, and after that, then like the housing authorities can go and ask for more once they can prove that they can utilize them more appropriately. And with our Keeping Families Together program, I know we're on pause as of last week here in Marion County, and our program, how it's supportive with services and alleviating those barriers. I'm thinking this can be an amazing extension of what you got going on there, or maybe adopting more of what we have, and because we got contracts with ODHS and we got the community action as the entity that has the supportive services and the case management and all of that. So I got your email. I'm going to reach out to you, and maybe we can have a further conversation about how can we bolster this or just create ideas and brainstorm.
Yeah, absolutely. And I actually did talk to Erica and crew last Friday, and reminded them that these many of our young parents have been in care at one point in time in their life.
Right.
So utilize these vouchers. So that was a reminder to them, as I like, oh yeah, okay, we're going to go back to the housing authority. So I'm hopeful that they are going to be pushing that, because I think for anybody, they should be looking at that. My impression of what is happening is that right now HUD is really a lot of that funding is at risk. There's a lot of doubts. But what there hasn't been, this administration's been really clear, the veterans vouchers and these FYI vouchers are priorities for them. I don't think this funding is going away. So, even more reason to use it as all of these other funding, risks are coming, and we're worried about that. I sincerely hope that FUP continues and that gets funded, but I just don't know. And so that's why I'm really wanting to press on people, like how important it is to not just consider the young people that are in care at this moment or were in care 3 months ago, but that you're asking your 23-year-old parent that's come in, have you been in care? It doesn't matter if you were in care in another state, as long as we can verify that counts. HUD doesn't, like the housing authority doesn't get any additional, as long as we're signing off on that. So as long as we've been able to verify in some way and we're willing to put our signature down, they can accept that, because again, this is a nationwide program. I think the last I was aware, there was only one state that hadn't utilized these vouchers. I don't know if they've changed since, but anybody should be accepting people, even if that care experience was in another state. We shouldn't be looking at, limiting this. We should look at ways to expand this, because this is this 18 through 24 thing is a wide window. And if they start at 24, that still could be that 3 to 5 years after that. It doesn't stop. Again, the biggest problem is sometimes the service provision can change over that period of time, because, different people are serving those ages. Yes, my contact information is definitely on at least one of the presentations, but I think both of them. Voucher availability in places willing to accept them. In terms of just vouchers, what happens is usually HUD puts out a notice of funding opportunity, and they have to do a big application. But what they've done with these FYI vouchers is they've just said, anyone who wants, any public housing authority who wants them and is willing to sign this MOU with the child welfare can get them. And the numbers look like, and I don't know if they're talking about any changes, but the numbers have looked like they can request one at a time, or they can request up to 25 at a time. So if they get those 25, or if they ask for 10 or whatever, the housing authority wants them to lease up to 90%, and then they can ask for more, for a total of 50 in a year. Again, I don't know if they're going to expand that at all, but that's what it's been for the last couple of years. So that's really important. In terms of units willing to accept them, that is always a challenge, because legally they can't say no based on the voucher. But as we all know, some people have impressions of voucher holders and attempt to or even bureaucracy that, it could be for multiple reasons, but they may try to say no. One of the things is you need to realize the easy reasons they say no. Some of the reasons they say no is the rent is, $1,500 and I need you to make triple the amount of rent. So it doesn't matter you have the voucher. Well, no, because that's not it. Because it really is, what are they supposed to pay? If they're supposed to pay $200, all they need to make is $600. They don't need to make, $4,500 to meet that triple the $1,500 rent. That is protected, and and that's something that you combat. But it's also the other reason why I think housing navigation is so important, because housing navigation are people that may, begin to have relationships with landlords. Part of the thing in the housing navigation we did is like, we want them to, have a relationship with the public housing authority. Like some of the housing authorities, like, yeah, they can go out with their inspectors, they can meet the landlords, they can do those kind of things so that they can initiate those relationships. And so those are the kind of things that we want a navigator to be able to focus on. We have people that are doing great jobs in this work, but they have such a broad array of things that they are doing that housing navigation, based on what I've been told in my personal experience, and I'm hoping our pilot will prove me right, is like it plays a huge impact, because housing is incredibly complicated and difficult to navigate, and people need some very hands-on support with that.
Thank you. That was
Yeah.
really helpful.
So my question, Stacy, since that's a lot of information. But one thing you mentioned in particular was interesting to me, especially because as you know, in Portland, we're dealing with housing issues, of course, in general and stuff like that, housing shortages. And so when you mentioned regarding 600 of vouchers and stuff like that, that made me wonder, are there any local regulations or anything that the state has to work with, say like, for example, in Portland, because I'm focused on doing a lot of work in the Portland area. Is there anything that that intersects with this that affects this in any sort of way that would be good for someone to know, and something that we could be talking to local governments about, or I guess the county as well, so Multnomah County in general. So because these are I want to see like what else is affecting that, because as we know, housing shortage, people don't want to be. A lot of people aren't wanting to be developers or like landlords at the moment and stuff like that, and that's something that is, of course, causing potential harm. So I would like to dig into that angle if possible to learn more.
Yeah, I think housing building is another whole beast, and I won't pretend to be an expert on getting housing built. I will say for
talking about, I know that.
Yeah, but for like current units, again, people should be going back to things like Fair Housing Council. Fair Housing Council has some great documents on their site, and they have trainings. They've done one for us, but they do trainings for lots of people. But that source of income one, again, is one of the biggest things that we've continued to encounter. Is a landlord will legally they cannot, but they will think they're justified in saying no by saying, hey, that rent is $1,500 and you don't make triple that. And we can say, no, it is illegal for you to discriminate based on source of income. And part of the source of income is this voucher. So you have this voucher, and then you have the young person who is contributing some. That, so you can't discriminate based on that. And so that's what we attempt to kindly push back on. Again, I've done it as a caseworker and had to learn, and didn't know it right away, and just had to learn over time. But that's why, I think that, we're trying to do more housing related trainings overall, because it's really complicated. And I think we're all better off in gaining some of this knowledge. And so, that's another thing that, like, we've had the Fair Housing Council come, Community Alliance of Tenants come, and different things. And like, I'm always open to hearing more about, different speakers that we could put forth to kind of present to everyone, because I think these are trainings that we're going to need more and more rather than less and less. And really, because DHS doesn't see itself as a housing provider. I mean, certainly they provide care to young people, but like they don't see themselves as a housing provider. We haven't done a lot of that, and so now's the time. Let's get it out there. People are struggling more and more with the housing, and so if we can take advantage of kind of collaborating in that way by having community providers and DHS, any DHS at a training, like that's going to be a service. If we can make sure we're sharing around those resources and offering up our trainings to each other and that kind of thing, I just think that benefits all of us.
Thank you. And then a follow-up question is, I might have just forgotten it. Sorry about that.
That's okay. Again, I am planning to come back, but two, I am always open to an email, a phone call, or whatever, because I really want feedback from around the state. I really want people's input about what's going well, what's not going well, and that could be anyone. It could be you, anyone on this call, or it could be you're talking to somebody and they're like, "Oh my God, I had this horrible experience, and why didn't DHS help with it?" Like, I'm okay with that call or that email. Like, those are things I need to know. Those are things that help me be a better advocate. And so I am always open to sharing out that information to somebody who you think would like to give that feedback. Happy to do that.
Yeah, I actually just remembered. So,
okay.
So another question, the follow-up question I had was, do we have like any metrics to look at to see like how often they're getting into that or into those programs, and then or like rejection rates or stuff like that, just so that we can like compare and contrast and see the data of how this is all intersecting and how it's all doing.
So some of the issues that we have there are, because FYI has been often when they've left care, we don't have a consistent data source. So we have things like you can look at, I can even share out the link. Like you can look at HUD's site and you can see how many, what states are, how many people they have leased up and those kind of things for these vouchers. So you have like pieces of data. We haven't been able to put them all together. Homeless youth system should have data about how many young people that they're serving that have experienced care. But again, they don't always share that data like specifically. Mm-hmm. So we don't then track it back to see like when they were in care or if they were in care in this state or not. So we've got pieces of it. We haven't been able to put it all together yet. And we have definitely a plan for our data for the pilot, for sure.
Yeah, that's something that, sorry if I'm interrupting.
No, that's okay, Dean. I'm just going to say, because we're running on time, anybody that has any questions, and looks like Casey is still in the car and Malik has had to step away for work. So any questions, you want to send them to me in an email and I'll make sure they get to Stacy, but she will be coming back next month. And so if you have ideas, and maybe Stacy, you can kind of summarize as you're ending with anything that the commission might be able to do that would be beneficial. And then we can be thinking about that. I can put ideas together so that you all have them for next time. And if there are any further questions, I can get them to Stacy before she comes next time.
Yeah, I mean, honestly, I think that there are so many different ways in which people could help. And I always, I compare it to, like, it's silly, but I compare it to like, I did a holiday party in a branch for years. And my request of people was always like, what can you give? Like, I don't need one thing. What can you give? And I'll see how it can play, and how it can contribute to this effort. And so I will say that there's plenty of things that we can do. There is sharing out information, so that if you realize in your community they don't have these vouchers, like talking to your local agencies and seeing like, hey, are you tracking young people that report being in care? Are you doing, because like that will help be an advocate. Hey, does your local community or does across the state, do you have like additional resources for people for move-in stuff? Because that's been a big issue. Like if we have a young person that's coming out of care, there might be some resources for move-in funds, but you have young people that maybe were in care when they were 10 and now they're 19 and they're homeless. They can qualify for this voucher, but where is the funding to help them move in? So like there's all kind of different things across a wide spectrum that people can do. So if you have any thoughts, like I'm open to them and I'm open to like talking through how we can support them and how they fit into your community, or how, it could be a statewide thing. Because I absolutely think we can do better. And, I can be a cheerleader for this, because like I don't get tired of talking about it. I just think it's really important. And so I'm always willing to kind of spread the word, but like I would love people that already know you and trust you and having the word rather than me. Like I'm happy to be there. I'm happy to do any of the things, but they're going to trust, your face, your word, because you are somebody connected to them and rather than me, who they may not know from anywhere. So, I just pull me in as you need me and I'll help as I can.
Casey, are you able to, do you want to go ahead and just introduce Rachel, or we just get started with that? And Stacy, we'll be back in touch. We'll make sure that everybody has the slides, and then any questions that might come, I'll send them your way and before the next presentation.
Okay, great. Bye.
Thank you, Stacy. Apologies to everybody for once again being on my phone today. I can't prevent court hearings from happening at my 10:30s, and then sometimes it keeps me a little late. So many apologies, but we're going to move to an update from the governor's office and ODHS on the short session at this point. I'm not sure, we've got both people listed, so I'm not sure if both Michelle and Rachel are going to kick this off, but yeah, update for the short session.
Sure. Thanks, Casey. Our plan for today, I'm going to start us off and I'm going to just share some updates from a big picture about our overarching goals and our priorities from the governor's office, share a little bit about the governor's top bills and some of our top goals for DHS. And then Michelle's going to jump in and speak to some of the specific legislation that we're working on, that we're tracking on a policy level, and we'll solicit some feedback on those bills. That's our plan for today. So I just want to start off by just acknowledging that this weekend was really hard and really challenging. And I just want to thank you all for continuing to show up and to be here, to be part of. I view this as how you're contributing to your communities and growing to how we continue to improve what we're doing. And I feel like the community that we're building and showing up and supporting one another is what we need to continue to do. The governor did just send out a press release, just sharing some updated information. On Saturday, we actually in the morning had a scheduled meeting already with a large group of immigration and refugee partners, organizations that represent all of our fellow Oregonians. And we had some key legislators as well who were really talking about what else can we be doing. The governor really affirmed her commitment to protect families statewide. We've been working internally with the Office of Immigrant and Refugee Advancement, which has been, we have a new director that we've have had there since July, who's just been remarkable, stepping in, listening, meeting with over 40 community organizations, developing our strategic plan for how we can continue to focus and where we need to continue to focus on how we understand what is the state role in supporting local communities. And I just say that all just noting, expect more. And one of the themes that you're going to hear, and I anticipate as we go into short session from a policy perspective, is going to be around the theme of, are there different actions and and legislation or efforts that we can be doing in Oregon to help ensure that we're offering protections that are aligned with the values that we believe we have as Oregonians to protect one another. So I anticipate, there'll be more details that come out. As you kind of got a little bit of a short foreshadow of that, but I imagine that the discussions about thinking about data, thinking about what are best practices, there will be work coming. Acknowledging that we're considering and looking at that, and really the governor's asked us to look at this more closely within our department as it comes to youth in our custody as well. Are there things that we can be doing for kids that are in the custody and of the state to make sure that we are protecting them from and that is part of a focused effort we're looking at just to see if there's anything else we can be doing administratively. How do we make sure that we're connecting all of the youth that might be transitioning at age 18, if they need access to the right types of lawyers and counsel, how are we making those connections? How are we thinking about what's the state's role? And just as a reminder for that, part of that context is the premise of child welfare and how we are guided is we don't have eligibility determinations. We don't collect data on whether someone is undocumented. That is not a condition of who we serve. We serve people based on their documented need, if meeting the criteria for when someone needs to come in to receive state support. So just want to acknowledge that that's a bit of kind of some of the policy landscape that you'll see. I know I'm starting on a really hard topic, but I feel like that is going to be a bit of what we're navigating and moving into short session are going to be many hard discussions, and that's a bit of the frame, right? So we anticipate discussions on the federal response and federal actions or responsive actions states can be taken. And then in that spirit, you're going to see strong request we're really in a preservation state. When I think about what our number one priority is for both Oregon Health Authority and Department of Human Services, our priority is to make sure that we are preserving and protecting our budgets in terms of being able to serve individuals that we need to serve as best we can. Doing so in a way that we are also balancing and navigating a challenging budget scenario where we have both a challenge of needing the legislature stating we need to make reductions and find reductions across the enterprise, and there's options that the legislature is considering there. And at the same time, we have based on to maintain food and health for Oregonians, we are asking the legislature, based on impacts from HR 1 and costs for administration, we need an additional $339 million this short session for both Oregon Health Authority and Department of Human Services to ensure we can maintain healthcare and food, that maintains the SNAP program in the state. And that puts us in a real challenging discussion where we're going to be navigating hard choices. And we can go into the details of what's included. I'm not planning on going into the details of all of what's included in the big budget ask. There are presentations that we can share with you. And I see Pam's question in the chat. There's a combination of both ongoing money and one time. So I just want to acknowledge the fiscal impact I gave you. That is a total number, and we do have that divided up in terms of what is going to be the ongoing dollars that we need versus what is a one-time type of investment. So for example, let me give one example there, is that SNAP benefits right now. You've probably been reading in the news and articles. We have people that are stealing other people's benefits through EBT skimming at grocery stores or ATMs, right? And the policy is that if somebody's food benefits are taken from their card at no fault of their own, those can't be replaced. So people are just out of luck. Their benefits are stolen, and that's done. One of the ways to help to improve that is to make sure that we're modernizing, putting chip cards in, just like you have on your ATM cards, right, to help protect against skimming. Moving to make sure that we actually have data security and technology investments to protect SNPs, to protect food benefits for individuals. That's an example of a one-time investment ask, ask that we think has a long value of maintaining people's benefits and making sure that you can continue to get food, but when the benefits are put onto your cards. That's an example of that. So the department has presented on this a few times, in particular, the January legislative days presentations. There were some long, really detailed presentations where the departments went through to the subcommittee on Joint Ways and Means. Here are all the different financial asks. Here's why we need these asks and why it's important to preserving our care. You're going to also acknowledge, as I mentioned before, in November, the department then also presented on, here's for your consideration, legislature, if you needed to make some reductions, here's some proposals that we would have on where we would cut staff, cut administrative services, do whatever we could that you could consider as you're also considering how you balance the budget. DHS is not alone in that. Every single agency is looking at those types of reductions, and the legislature is then going to be looking at, what are the final numbers? How does this work? A little bit of what happens is we don't know what's going to come out yet and what will happen. And that is what we are going to be navigating together, right? As we go into short session. What will happen is that at the beginning of February, on February 4th, there will be a forecast and there will be a number that's released that says, all right, here's the actual number that we need to budget to. And so once lawmakers and the fiscal teams all understand what's the total number of projected revenue that we have, what's the forecast look like, how much money do we have, we will know how much of a hole and kind of what the level of reductions needs to be and what those options are. The legislature will use that to then help guide the rest of session in terms of making decisions. I don't anticipate seeing a lot of details about what reductions will be accepted by the legislature until towards the end of session. And I state that to just remind folks, like, if there are reductions or investments that you want to make sure that we're stating we should continue to maintain, we want to preserve, that is an advocacy moment that we have, that everyone has as advocates, to share that information really over the next month or so, is that kind of timeline, just acknowledging that. One example I want to make, you heard Stacy presenting. I love that when Stacy comes to present, and as you know, the governor has has had a goal of helping to work on reducing homelessness. And one of the efforts that she had was ask DHS, we need to do more for how we're connecting and building out the programming for youth exiting foster care into ongoing housing. So I'm happy to hear that, Stacy kind of present and continue to present on that work that she's leading and how she's making those bridging connections. And with that, we had invested in the Youth Experiencing Homelessness program. An example of the preservation mindset that we have going in, for example, is that we have not, in the reductions that were put forward by the department, we did not reduce youth experiencing homelessness, for example, right? We held that harmless, and we're trying to preserve as much we can. How can we maintain our efforts that we've done there and continue to make progress? So I'm just trying to give that as an example of kind of the connections and kind of the work that we have. So in addition to kind of that landscape of really having like hard budget and revenue discussions, that's what we anticipate in short session. The governor has 3 bills that she is advancing directly. I will give high level updates here because some of them, they're not necessarily related to foster care youth, but I think it's important for context to know where the governor is advocating for some additional policy change. One that I would say does have strong connections. We had established a behavioral health talent council to really address the crisis of not having behavioral health workforce. And so as we looked at, as you know, our trajectory had been, we had put investments in both building capacity, like physical space for behavioral health. Then we also had investments for growing our workforce as well. And now we're focusing not just on the investments, but how do we help to make sure that we are looking at the regulatory systems, looking at our system, getting feedback. What do we need to be doing from a policy perspective to help to make sure that we can continue to recruit and retain a strong behavioral health workforce in the state? So this bill is really focused on that kind of administrative streamlining. One example is we have we require behavioral health workers through the Oregon Health Authority to get credentialed or licensed through a lot of different groups, right? We have a lot of different oversight, and we have coordinated care organizations that also have their own ways to like how to oversee behavioral health providers. What we are looking at is we are proposing that we have a centralized credentialing process. Instead of having this deregulated, have multiple ways to be licensed and standardized, we need to centralize, need to streamline so we can help to ensure that we're maintaining and growing access for who then gets covered under those different systems. We are also really looking at how do we help look at administrative requirements and looking at duplicative reporting for behavioral health workers. We're looking at some changes with the licensing work at the Mental Health Regulatory Agency and some of the different boards. How do we look at where there's overlap between these multiple boards and having different types of reporting, and we're streamlining there in terms of helping to improve accountability. And then similarly, really looking to see where we can have more cross-license supervision and cross-licensing work to make sure that we're growing licensures and improving access to behavioral health. Second bill that the governor's working on is an economic development package. The governor is really looking at how do we help to make sure that we are retaining and growing Oregon businesses, looking at job creation and accelerating economic growth at this time. One area is looking at a fast-track permitting process to help look at qualified economic development projects being targeted for fast tracking to help think about building growth there. Also, that same theme of looking at where we have auditing and permitting that needs to be streamlined, where we can help to make sure that we're looking at an inventory of permits for all natural resource agencies. Where do we have these permitting delays? And then when we have these permitting delays, how do we help to make sure if it takes longer than expected, we refund the permitting fee, for example? Really helping to put the onus and incentivize. We need to not have permitting be a barrier. It needs to be part of a process, but we need to streamline it, and we need to make sure that we are incenting those doing that permitting to help get the work done faster. And then you'll see some work as well with enterprise zone modernization as well, making sure that we are using that economic development tool to increase access by looking at, there's some modifying of job creation thresholds and looking at what businesses are eligible for that as well. That's the second bill. And then the third bill that we have, the governor is advancing, and I'll do the third bill, and then I will absolutely open it up for questions. So I just want to confirm that. The third bill that we have is related to housing, and the governor is looking at how we can help to produce more folks for older adults and manufactured home communities. So acknowledging that Oregon's population continues to grow older and older adults have fixed incomes, housing is becoming more expensive. How do we help to make sure that we're generating more housing in the marketplace? That is what the intention of this bill is. Manufactured housing also is very affordable, and a single manufactured housing can produce at better rates than an individual. And so the idea here is that how do we use an ability for looking at urban growth boundaries to make sure that cities can add sites that are specific to housing for 55 and older communities or manufactured home communities to make sure that we are incenting and able to grow the affordable housing that we need to help with our older adults. Those are the three primary bills that we have that the governor will be advancing. And just to acknowledge, there are many other bills that are also pertinent to child welfare that Michelle and I have been working on already with many of our legislators that we'll go to next in the presentation. I do want to make sure we answer Dion's question, and then I do want to make sure we get to some of the policy bills that Michelle has as well.
Yes, thank you. So I have a couple specific remarks and questions in regards to the licensing thing as well as economic development and the housing thing. These are all things well, besides the licensing, but you'll see why I have this question in a moment. So first off, great to hear, we're working on streamlining and stuff like that. The question that I have in regards to that is how, and I guess this might also factor into the health thing in general, mental health in general. So one, as you know, we are losing, of course, healthcare facilities, especially in Portland at the current moment. In East Portland, my community is at risk of losing all of our hospitals and stuff like that. And we've also seen mental health care facilities and facilities that provide, this a bunch of services towards high need populations leaving the state recently. And then also, all right, so first, I guess this is really a two-part question. One, what are we going to be doing to be attracting more of those providers to Portland and Oregon so that we can ensure that the healthcare remains affordable and local, and that we're providing, these jobs to locals instead of outsourcing, which of course will harm our revenue base, which will lead to, again, less revenue to actually fund these programs. And the second question is in regards to licensing and stuff like that. One thing I've been a big advocate for many years is holistic full spectrum healthcare. And that includes stuff such as not just, mental and emotional, but like social and even to an extent spiritual, though that itself is it's more complicated. It's not like it's not like religion stuff in particular, but basically, a whole spectrum, whole like body of whole living being spectrum of healthcare and stuff like that. And so in regards to licensing bill, I'd be interested to see if you guys are doing any innovations that allow for more types of healthcare to be provided, essentially, especially ones that are growing with lots of new data that could be helpful to high need populations, such as neurodivergent populations with mental health care issues like BPD or stuff like that. And of course, just people in general, since one thing I think one of the biggest crises of our time and for the past several decades has been a lack of a cohesive, full spectrum, holistic healthcare system that takes care of every aspect of individuals' needs. I think that's a big thing that I'd be excited to see what steps are being taken towards that. So, and then I'll say the second, third question after.
Great. So you gave me a great opportunity to highlight on January 20th, the governor announced that she has been working with the Oregon Health Authority and hospitals on a $25 million stabilization fund to help work with our hospitals who on stabilization payments. The intent is to help with making sure that our small rural hospitals, especially those offering maternity services that are closing their doors, are able to maintain in operation. This is a small step that the state can take, but it is part of recognition that we need to make sure that we have a healthcare system that is strong in the state, and we need to keep working through this. I would also note, secondly, the rural health transformation funding that did come from the federal government as part of an alternate way to look at how do we help to make sure that we maintain our healthcare system. OHA did receive funding for that, and so you will see some rural health investments that are moving forward as well, though limited, but it will help. To the broader question, we absolutely support, and we need to think about whole person health, and we do need to think about how do we help to think about the different licensing types that we have, and making sure that we help with streamlining and not making it harder for individuals is part of the overall arching approach that we take. So if somebody has done training and met certain certification requirements for one provider type and they want to go to a different type of industry, like how do you help to make sure that those credentials and training are stackable and move with them? That's part of the overall kind of healthcare workforce approach that we take, although we are not addressing that in these bills and legislation that we're advancing at this time. One example that I will make a connection to, not a governor's bill, but an example of how do we need to keep growing the workforce and expanding into different ways of growing, especially helping kids and families, is at the Ballmer Oregon Ballmer Center does have a licensing bill to help with a new type of licensure requirement, licensure and education program that they're working on to help make sure that they can get the work that they're doing to educate all these students in this new program and this new college program that's really intended to help with preventive and whole health work and to help be able to like work in social services and work in type of child welfare settings. How do we look at how should that type of education be connected into our behavioral health licensing system and make sure that there's a career pathway for that work? That's an example of the type of career pathway legislation that will be discussed this short session. That is not a governor's bill, but related, that will be in the behavioral health committees and connects to child and youth. I want to make sure we have time for some of the children and family legislation information that we've been working on. I want to make sure Michelle has time to go through a few of the key bills that we think it's really important that you know about as we go into short session.
Yeah, thank you very much. Let's go ahead and that. And anybody having any additional questions, just put them in an email to me. That'd be great.
Okay, I'm going to cruise through these as quick as possible. I do have another meeting after this, and so I'll start with the Senate Human Services bills. There are 3 committee bills that each have some type of impact to child welfare or child abuse investigations. The first one is, and I have the legislative concepts numbers. I know that there are some bill numbers that are out there, but I have not yet totally transitioned to those yet. So bear with me on that. But LC 68, you may recognize this bill. It is the combination of 2 bills from last session that the governor had to veto that had to do with the Foster Care Bill of Rights, but then added an expansion around who would be investigated for child abuse under ORS 418 definitions or the child and care definitions. What I'll say is in the interim, since 2025, the agency has worked on rulemaking to make the changes from those previous bills within our authority that already exists. There were some changes that could not be made because it would need legislation to pass. Like, for example, the foster care sibling bill of rights that would have a requirement for the judge to make an order on any kind of limitation or restriction on sibling contact. We can't do that through our administrative rulemaking. That would require legislation to pass. So that's something that was not done in the interim, but is in this bill to move forward. While the agency is neutral on all bills at this point, unless the governor's office gives direction, I will say we are in alignment with the values of increasing and ensuring the rights of children in foster care. I think that's demonstrated by the efforts that we did in the interim to try and move those forward despite legislative requirement. One of the other things that's going on about foster care Bill of Rights, which is actually my next meeting, is we are working on creating a video for youth, from youth to youth on their rights while in foster care and with their siblings. We understand the poster is important, but when we talk with youth, they would prefer an alternate format and video. It's just kind of the age of where we're at, right? So that is something that we're working on and trying to prioritize for this year, as a new communication with kids at kind of some different levels. So
Hey, Michelle, I
yeah.
want to just make sure I jump in for this is as this is a governor's foster care commission to just make sure that I also complete note that please know the governor, we are absolutely supportive of Foster Youth Bill of Rights and ensuring that youth have their rights met. And just to affirm, that policy intent was never what was at debate. Part of the navigation that we were navigating is that that seems to be the only part of the bill that ever got talked about and that was actually publicly expressed. There was a different section of the bill that changed the definitions of child abuse investigations and who would be investigated like an agency that where as opposed to if you are a parent or you are a child in care or if you are a child that is outside of an agency. And that is an area where we had identified we need to have further discussions on the impact of changing the scope of who is included in having who is included that would then be subject to agency level regulations and jurisdiction. And that's a policy discussion we think we need to have that should be discussed. And there should be information that's shared and that we're all making an informed decision and assessing, is that the direction that we want to move? And do we agree that we need to move that? So I just want to make sure that that nuance was clear, and we're happy to get more information on that. And I welcome a discussion with you to hear more about your thoughts on that as we look at the different nuances of that bill. Thanks, Michelle.
Yeah, I would just add to that. So if you're looking at that bill, it's sections 4 and 6 that we're talking about. They are not the statutory, they are not the statutes that have anything to do with the Foster Care Bill of Rights. They're around investigations under the ORS 418, which historically has been around applied to caregivers when they are having children reside within their program or they're providing specific services as a certain licensed or certified provider. So I kind of think about it like the bubble today is around the settings and around the caregivers within that are caring for kids in those settings, regardless of their legal status. Many of those kids are in the custody of their parents. They are not child welfare youth. But now it's talking about adding a bubble around children who are in legal custody of DHS or in the physical custody of DHS. And that would then, like, we're trying to understand, does that then mean that whoever interacts with that child is subject to 418 child abuse investigations and not just 419? And trying to understand what that meant for reunification. We know that was a concern from last session and trying to not hold parents to those higher requirements. But anyway, there's a lot to that. We're happy to come back and talk about that one, but I want to go through the rest of these really quick. That is probably that's a pretty significant bill. LC 280 is an ODHS omnibus bill. That does not mean that ODHS asked for these. That is just the title that the committee has talked about it. It has aspects that impact ODDS, APD, and then it has a section for around child welfare for limited exceptions to out-of-state placements. One would be for compliance with ICWA. One would be for ICPC placements. And then the last would be for specifically eating disorder care. We are still kind of waiting for Medicaid to understand the eating disorder care exception to know if that is in compliance with Medicaid or if it would be a violation of Medicaid for kids only in child welfare custody who are on Medicaid to have additional restrictions on that type of out-of-state treatment. So more to come on that. LC 281 is called the Child Caring Agency Omnibus Bill. It is very similar to the Dash 11 that Senator Gelser Bluen put forward on House Bill 3835. And it kind of shows up in this where the Judiciary Committee also put forward a bill, House Bill, LC 238, which is coming from Rep. Krupp and the Oregon Alliance of Child Care Agency Providers, that is more in alignment with some of the provisions of 3835 as were written and passed in the House Rules Committee. So those are a bit of competing bills that would have conflict if both were passed. So that conversation around 3835 continues as those problems and barriers still continue. The other bill that we're talking about in the Senate is an immigration-related bill. And I will just talk right now. I think that there is a judge that put a proposal forward that would add protections for youth and families to not be detained if they are engaging in dependency court. I think we are also looking at how that could be expanded to DHS offices or other locations where our youth or families are engaging because of dependency court activities or requirements. And I know we were also curious, there's some language that was put into an education bill, but clarifying in our protective custody language where it says law enforcement or child welfare or a counselor can put a child in protective custody, that we make it clear that that is not immigration agents or border patrol, so that there's no confusion that somebody could take a child into custody of any kind legally within this state. I know the protections currently in the proposed language are around wards of the state, but trying to have a little bit more expansive language that, as I know the judge probably knows, or many of you know, there's temporary custody and other things like that lead up to being in our custody that we want to make sure is also inclusive. So would love feedback, especially from you, Judge, if you have any thoughts on how we can make sure that language is expansive enough to feel like it covers things. But I think there's also conversation about how do we allow for virtual court hearings, make accommodations for families and children when they are not feeling safe going to court because of risk to being caught up with immigration. The House bills, we have LC 236, which is very simply a fix to allow for ICWA placements out of state when they are in compliance with ICWA. And then there's LC 266, which is the House Committee's response to the House Bill 4086 work group reports that were delivered in September to the committee, and have some initial child welfare reform suggestions. One, raising the standard of proof for a founded disposition under 419B, which is applied to families and community, from reasonable cause to believe to preponderance of the evidence. 36 other states, I think, already use that standard. It is kind of the norm. We are one of the only, I think we're one of 5 or 6 states that have the lower standard. That also has a provision to change the definition of threat of harm, which Oregon is already unique in the country for having that type of definition, but it aligns that language with CAPTA, which is the Child Abuse Prevention and Treatment Act. And lastly, there is an attempt that I am still waiting for final language on so we can do some analysis, but trying to identify the scope of who is a perpetrator under ORS 419B. Again, we're an outlier in the country that we don't identify that. Most other states have it as either a parent or caregiver, and caregiver is broadly defined by states. For Oregon, we investigate anyone and everyone, including minors, who are peers, not parents, under 419B. And so trying to have it very clear legislative intent of who we investigate. Child Welfare has participated on the work group that the committee has been hosting for the past few months for technical assistance, and we will likely be presenting on kind of our review and data analysis of what those policy impact would be. And I think that's it. And then so I think I already talked about Rep. Krupp's bill and judiciary. So any questions on any of those? A lot of stuff for short session, but. Rachel, do you?
Thank
Oh, go ahead.
Michelle. I was gonna say thank you, Michelle. There's a lot, and
Yeah.
I'm just worried about time because I think we're over time, so that's the sad part.
Yeah. So I was going to say, Michelle, I know you got to run as well. So potentially, if anybody has follow-up questions for Michelle or for Rachel that came out of this meeting, if you want to put it in writing and send it to Ellen, I think we can get it over to you. And then would that be okay, Michelle?
Yeah, just so that people know, I anticipate public hearings probably happening next week, or at a minimum, informational hearings happening on all of these concepts next week, and then likely public hearings and work sessions. Since it's short session, things move very, very quickly. So stay tuned or put it on your calendar to watch on Tuesdays and Thursdays if you're interested.
Michelle, as you get the numbers that when they change from LCs to House bills or Senate bills, will you send those to us so we can track them?
Yeah, I can definitely do that. I need to do that already, so.
Okay. We'll aim to finish up this meeting really quickly. So we'll move to the second to last section. Do we have any commissioner questions, concerns, or topics for future hearings or future meetings? Given none, we'll move to the last section, public comment. We'll open it up to public comment at this point.
Just want to thank you guys all for the work you're doing and for the educational information you guys brought to the table today. It's great to hear.
Thank you, Matt. Any other public comment? Okay. With that, we'll go ahead and move to adjourn the commission meeting at 1:05 p.m. Thank you, everybody.
Thank you.
Thank you.